Good morning, everyone who is joining us from America, and for those joining us from the UK, good afternoon. I'm John Drake. I'm Director of the Wales Violence Prevention Unit, and it's mine and my colleagues' absolute pleasure to join you today to talk to you about how we've been trying to implement a public health approach to violence prevention, and in particular, applying that approach during the COVID-19 pandemic. So as I say, I'm John Drake, I'm the director of the unit. I'm joined by my colleagues today, Laura Snowden, who's our public health lead, and is the lead for the violence prevention programme within Public Health Wales. Dan Jones, who's director of the unit, and Emma Barton, who's the violence prevention outcomes manager. So I'll be taking you through some introductions to the violence prevention unit itself, just a little bit of scene setting around how we're structured, who's in the team, and a sort of brief outline of how we work and why. Lara is then going to talk to you more specifically about how we take a public health approach to addressing this shadow pandemic of violence. Then Emma is going to talk to you about data. So Emma's an analyst within the unit, and we'll talk about how we use data to help prevent violence, that really important first step in applying a public health approach. And then Dan Jones is going to join us. Dan's got a long history in terms of preventing violence, particularly within the nighttime economy. So violence linked to pubs, clubs, late night entertainment. And Dan will talk to you about how some of this evidence from the other presentations is then applied in operational practice to help prevent harm to our communities. So just in terms of, again, this sort of scene setting and sort of our belief within the violence prevention unit. I really like this quote because it sort of sums up what we're all about. We do believe that violence is both predictable and preventable, and the risks of violence are actually modifiable. So very much like any other disease, where applying the right interventions, the right approach, you can actually both predict and prevent violence. And that's very much the ethos we take within the violence prevention unit. So our mission of the unit is to prevent violence across Wales through implementing a public health approach. And this is our mission, which we live and breathe every day. So our belief is that the only number that matters around violence is zero. It's predictable, preventable, and there should be none of it in our society. So we'll work tirelessly to try and get ever closer to that reality. And I'd like to take you through a little bit more sort of detail now about how we do this. So I appreciate many of you are from other countries who are joining us today, and just to sort of mention, Wales is one of the nations of the United Kingdom on the sort of western side of the British Isles, very similar to Scotland, Northern Ireland, in that many of the responsibilities in Wales are devolved to the responsibility of the Welsh Government. So there's a Welsh Government in Wales who looks after issues such as education, social care, health as well. So that's important to mention. And Wales itself has just over 3 million people who live there. Most of the population actually live in the southern part of Wales, and specifically South Wales Police covers an area right at the bottom of the country, as you can see here, and there's around 42% of the population live in the South Wales Police area. So as you can see on the map, there's 4 police forces that cover Wales. And of course, as you might expect, the most densely populated area, South Wales, that also reflects in the scale of violence that's prevalent there. So in numerical terms, the highest amount of violence takes place in South Wales, in the South Wales Police area. However, if you just run the data a little bit differently and look at crimes per thousand of the population, so that's violent and sexual crimes per thousand of the population, you can see there that it then becomes a lot more equitable. So, between the 30 to 37% of crimes per thousand of the population, as you can see. One of the things we've also looked at, just in terms of scene setting, is of course violence, as you can see from this, impacts every part of Wales and every community within Wales. But it also impacts on other public services as well. So as you might imagine, policing is a very obvious one, but we also had a look at the annual cost to the healthcare system each year of violence. So that's in terms of both treating injuries, but also some of the long-term effects, such as through adverse childhood experiences, as children who experience violence are so much more likely to become perpetrators of violence themselves, or likewise, some of those long-term costs are really important. So we calculated those costs at over £200 million per year. So as you can see, violence is prevalent, it impacts all our communities, and it impacts our public agencies as well. One of the things we're often asked is, we said our mission is to try and tackle all violence, and why would we not just focus on some of the higher impact crimes of violence? So why not just focus on knife crime, for instance? So we had a look at sort of typical knife crime perpetrators of violence, and what do we actually know about that knife crime perpetrator? What characteristics do they have? Well, as you can see, only around a third of them are under 24. So often, particularly knife crime is sort of badged as an issue that affects young people, and it does. But the point is, it affects all age groups, as you can see from that first statistic there. Mostly men, and certainly in South Wales, mostly white British men. Importantly, though, near 85% are already known to the police in some way. So these are perpetrators, offenders, who in some way are already known to the police. And in fact, they're known in a number of ways. So if you just look to the right-hand side, you can see that there's information about those knife crime perpetrators around a number of other issues, such as domestic abuse, such as mental health and drugs. So our argument would always be, in order to tackle any form of violence successfully, we need to look wider than simply the sort of crime type, the offence type itself, and certainly issues like domestic abuse, mental health and drugs are very cross-cutting, and so consequently are also part of our focus. I mentioned about responsibilities in Wales being devolved to the Welsh Government, many of those responsibilities, policy responsibilities, and Welsh Government are also able to pass legislation in Wales for Wales. A number of those pieces of legislation are particularly important to our business of preventing violence, and just to highlight a few. So adverse childhood experiences, a real focus on an approach to adverse childhood experiences and prevention. The Wellbeing of Future Generations Act is a specific piece of legislation that tries to help to protect the future for children now growing up in Wales. So again, a very sort of powerful piece of legislation. And many of you will have heard of some of the earlier sort of pioneering work around violence prevention, such as the Cardiff model, led by John Shepherd. Professor John Shepherd, who's actually a member of our team as well. So John was a real pioneer on this approach of drawing together data from different sources, particularly from accident and emergency departments, together with police data, to really try and unpick any hidden harm that might be in the community, and particularly try and identify sort of nighttime premises that might be a cause of particular types of violence or extreme amounts of violence. So I suppose if I had to sum this slide up in a nutshell, we're a fairly new team. Most of us have been in post for around a year now. And I think we're very lucky in Wales that this sort of groundbreaking work has taken place already. So this has enabled us, I think, to hit the ground running far more successfully than if we were sort of trying from scratch to be making a case for taking a preventative public health approach. In terms of the Violence Prevention Unit, who we are, I've introduced you to a number of my colleagues who are speaking today, but we're made up of sort of three groups. if you like. So we have core members whose day jobs is violence prevention, working within the team. And our team is drawn from around 30 different organisations. So we have police, we have Her Majesty's Probation, we have child sexual exploitation experts, we've got senior public health officials and analysts, and police and crime commissioners team as well. So quite a broad mix of full-time members of the team who are in that middle sort of box or rather circle there. On the left-hand side, you can see we've also got a scheme where we call associate members. So these are people who have a day job, but they join us, you know, on a part-time basis, seconded from their own organisation to work with us. And as you can see, we have a broader range of members from in that category as well, such as third sector charity workers from organisations like Barnardo's and Crime Stoppers and the Waddle. And we also have Welsh Women's Aid, for instance, who are a charity that leads around domestic abuse in Wales. What we also do is we have a grant where we're able to directly commission service. And on the right-hand side, there's some examples of some of the services we directly commission. So, for example, we have some nurses who work at a hospital in Wales, at one of the largest accident and emergency departments, and they will intervene with victims of violence who are brought in, particularly knife crime victims, and try and steer them on a different life path at that teachable moment. And that's a really successful intervention that we've commissioned, and one which I'd really love to be able to scale up broader across Wales in the future. So that's from myself. That's the sort of introduction to the unit. And I'm now going to hand you over to Lara to talk in more detail about how we take a public health approach. So, Lara.
Thank you very much, John. Good morning and good afternoon, colleagues. I'm here to discuss a public health approach to violence prevention and how we've adapted this approach during the COVID-19 pandemic. So public health is about the health of the population. So whereas a doctor might consider the health of an individual, public health professionals instead use some of the methods that are described in this diagram, such as surveillance, health promotion, research, emergency preparedness, analysis, to influence and prevent ill health in the general population. So my specialism within public health is particularly around violence prevention and how we can use these methods and adapt them to the specific issue. Next slide, please, John. So this is an issue that has only recently been considered as a public health issue. I think in the past it's really been looked at kind of through a criminal justice or a policing lens. But there's a lot of tools and evidence that we can bring through a public health lens, and particularly that sight of the problem as a whole population health issue, rather than just the individual behaviours of a small minority of people. Instead, we can see it as a societal issue, which we can both predict and prevent, as John said at the start of the presentation. So this diagram here, oh sorry, if you go back, John, this diagram here describes an approach which was developed initially by the World Health Organization. It's a four-step approach which describes the public health approach to violence prevention. So it starts with surveillance and epidemiology, so understanding what is the problem, and then looking at identifying risk and protective factors for violence prevention. So what are the things which increase the likelihood of violence? What are the risk factors? And what are the things which make us more resilient to violence? What are the protective factors? Looking at those causes as a whole, we can then look to develop and evaluate interventions that work to prevent violence, and specifically what works for whom and which groups. So we can then look to upscale and evaluate those effective interventions and deliver them across the population. So key to our approach within the Wales Violence Prevention Unit is really an empowerment approach. And even though we're a small team, we work very closely with partners to support them to implement evidence-based and preventative violence prevention activity. Next slide, please, John, thank you. So looking to adapt this model during COVID has been a really, really interesting challenge, and one that we never expected we were going to have. At the start of the pandemic, there was very little known about the association between violence and infectious diseases, and particularly the implications of the public health restrictions, such as lockdown measures and social distancing restrictions, and what impact that would have on other public health issues, such as violence prevention. As the pandemic kind of wore on, there was an emerging understanding that things like lockdown were exacerbating risk factors, particularly for violence in the home and online, so intimate partner violence, child abuse, for example. So these risk factors are things like proximity to the perpetrator, the opportunity, mental health and financial concerns, increased alcohol and substance misuse, reinforcement of traditional gender roles in the household, and of course, a reduced access to support services for victims as well, support services for victims. All of these things increased the risk of violence. And concurrently as well, there was a loss in protective factors. So things like the closure of schools that we've seen across the world, access to supportive friends, extended family, the workplace, and other support mechanisms that, that victims or people at risk of violence might use. Thank you, John. Next slide. So this led the United Nations pretty early on in the pandemic to coin the phrase the shadow pandemic, particularly of violence against women and girls that ran alongside the COVID pandemic. So this phrase is often used that COVID is syndemic, and really what that means is that it interacts with other diseases and health conditions, including the environment, which provides and creates the conditions for health or ill health. So that includes things like housing, poverty, education, and experience of violence and ACEs. So what that really means is that COVID-19 hasn't existed in a vacuum. So instead, it's really created this kind of perfect storm really for health inequalities to perpetuate. And although COVID-19 itself has been, we've seen that it's disproportionately impacted particularly men and Black and minority ethnic groups in terms of the disease itself, the impact of the shadow pandemic, violence, adverse childhood experiences, has been felt disproportionately by women, children, young people, older people, people who are perhaps socially isolated and are more vulnerable and at a higher risk of victimization. Thank you, John. Next slide. So that's really just described some of the theory behind what led the UN to describe, to use the phrase, the shadow pandemic. I think the other really important thing here is to consider the really long-term effects that we might have as a result of COVID-19. So obviously we're still in the very early days of this, and something that we're trying to do is map and understand the violence surveillance data so that we can look at what the kind of more immediate, but also the longer term impacts that things like the increased economic insecurity, perhaps increased gender inequality, increased risk of poverty, what these things might look like in the longer term in terms of violence and ACEs. So I think that's just a really important thing to remember. It's not just going to be an immediate impact. Next slide, John. Okay, so what did we do and how did we adapt the public health approach to violence prevention that we have in Wales during COVID-19? So our approach really centred both around data, but also having a really unique multi-agency team, which John has described, in which we have public health, policing, commissioners, health staff from accident and emergency departments, domestic violence and abuse and sexual violence agencies, prisons and probation, but then also a really strong violence surveillance system where we were able to develop a very rich and real-time system which used data from kind of accident emergency departments, the police, the ambulance services, but also voluntary sector agencies, helpline statistics, to generate a really rich understanding of kind of where the trends, the patterns and the hotspots of violence were during the pandemic. These things were then really used to inform violence prevention and response activity. We've also done a lot of research during the pandemic, so particularly exploring the epidemiology of violence and also looking at what works or might work because of the changed nature and context of violence prevention, and our just general living situation during the pandemic. A really key part of this is around advocacy and communications, so ensuring that stakeholders were up to date and informed of what the data was saying around violence, and enabled us to really take a data-led approach. And the impact of this, we're currently evaluating the impact of this kind of real-time surveillance that we were able to adopt, but we think it's been really impactful in terms of implementing both more prevention activity and ensuring that the focus on violence prevention doesn't just get shifted to response, but that we can continue to invest in violence prevention during the pandemic. Also in terms of better targeting of response activity, but also we think it'll be impactful in that COVID recovery period that we hope we're entering now as well. But critically, all of that information was kind of fed back and discussed within a multi-agency team, initially weekly at the start of the pandemic, and then as trends began to stabilise, then monthly. And I think that was really, really critical and provided a very kind of unique opportunity really within Wales. Okay, next slide, John. Okay, I just wanted to finish before I hand over to my colleague Emma. So we've done a lot of research, I mentioned, about violence and COVID, and we hope to continue to communicate the evidence that we've generated during this period. So in a second, I'll hand over to Emma, who will talk a lot more about the violence surveillance work that we've been doing. So that's been an ongoing piece of research. And we hope to continue to kind of publish on findings of those as we go forward. My colleague Dan later on in the presentation is going to talk a bit more about the work we've done around reopening nightlife after lockdown periods and looking at how we can do that safely and prevent violence. We've also been doing a lot of work trying to understand the health need associated with violence and ACEs experienced by children and young people in Wales during the COVID pandemic. We've done an interim report on this, which is available on our website, and we're going to be publishing a full health needs assessment likely to be due in May 2021. Looking forward to sharing the results of that. And finally, we've been doing a lot of research, specifically looking at how we can target more preventative services during COVID. So one of the things we're looking at is around empowering bystanders to prevent domestic violence and abuse. So we've been doing a survey with bystanders to try and understand how COVID has impacted on their actions. This will be used to inform sort of bystander campaigning and training later in the year. So that's another really exciting sort of opportunity. So that's a kind of summary from me. I'm going to hand over now to my colleague, Emma. Thank you for listening.
Lara. So hi everybody. I'm just going to spend hopefully the next 10 minutes just providing a brief overview of how the VPU has utilised data to provide some of the evidence to support the prevention of violence, as Lara's mentioned already. So as we know that there is obviously a growing understanding that violence is preventable as a key public health issue. And from previous work, we know that police data alone does not provide a comprehensive understanding of violence. And so therefore, this has led to a history in South Wales and a collaboration and partnership working to prevent violence and respond to vulnerability in Wales. And initially, a multi-agency approach was set up in around 2014 to better understand violence and inform preventative action. I think the organisations that committed to this were police, health boards and Welsh Ambulance Service. And they were committed to work together to identify common issues, to understand the challenges faced by services, and to progress sort of delivery of joint priorities. And this included identifying potential indicators of violence and vulnerability at the earliest opportunity to reduce risk of harm through early intervention and prevention with partners. So initially, the initial violence surveillance system was established across South Wales in 2015, 2016, and now is maintained within the Wales Violence Prevention Unit. This, as I said, collects police violent crime data, accident and emergency health attendance data, and Welsh Ambulance Service violence-related call-out data. Thanks, John. Next slide. Thank you. So the violence surveillance analysis and reports that were provided and still are identify trends in violence, including victim demography, type of assault and specific locations. It highlights the burden of violence on health services, provide evidence-based advice to inform localised solutions to tackling violence, and it maps hotspot areas and communities at risk of violence. And the reports also profile communities that are not known to the police by cross-referencing emergency data and police data. Very sort of a unique part of the piece of work that we've been doing in the project is that we can receive personal identifiable data, and this allows us to link individuals across services. So police and department assault data are cross-referenced, and what we've been able to see in the past is that approximately 40% of attendees are turning up at emergency departments unknown with the police, so the match between two data sets. So this does suggest that the vast majority of ED attendances for violence-related injuries are potentially unknown to the police. And we've actually found this to be as high as 70% during the pandemic. So by mapping the residential location of those who have not reported an assault to the police, we're able to identify common attributes of individuals within communities that are potentially under-reporting violence. I think all this activity enables the VPU to establish a better understanding of the true reflection of violence, certainly with injury across South Wales. Thank you, John. Next slide. And in addition to the violence surveillance data, as Lara's already mentioned, we've been producing monthly violence monitoring reports. We bring together partnership data, analyse the data and monitor all forms of violence to identify trends, patterns and hotspots that are emerging. And this real-time violence surveillance enables partners to initiate data-led prevention and response measures, both now during the pandemic and hopefully as public health measures are lifted, it helps services to be able to plan ahead really and provides an evidence base for future events. The monthly monitoring reports, which were originally developed to observe the impact of COVID-19 pandemic and the implemented restrictions on violence, are now considered business as usual within the VPU. And due to the cross-organisational working and multi-agency setup of the VPU, we have found that our response to COVID has accelerated the need, understanding and desire of partners to share data to contribute to the unique perspective on the current picture and trends in violence. And these reports form part of the Wales Violence Prevention Unit's commitment to assist and support partners with multi-agency data analysis and provide recommendations, next steps, and a forward-looking approach to violence prevention, intervention and policy. And the violence types that we generally cover are violence against women and girls, domestic abuse and sexual violence related to children and young people, serious violence, organised crime and knife crime, self-directed injury and violence, so we look at self-harm and suicide, nighttime economy and alcohol-related violence, and then other forms of violence. So certainly during the pandemic, we've also looked at hate crime and violence to key workers, frontline workers, and those kind of events that are occurring more. And then we also add context to the data that provided in terms of looking at sort of the inequalities, looking at those wider determinants, as Lara's mentioned, around gender, age specifically, deprivation, and ethnicity. So, and they're just listed below there a number of the different partners that work with us to provide data to bring us a more holistic understanding of violence. So thank you, John. Next slide. So as we mentioned, we aggregate multi-agency and partner data on service demand, violence types, and we use professional insight as well and ask for professional judgment that has enabled us to monitor trends of violence during the COVID pandemic. My next couple of slides will just go through a couple of key trends that we've seen in some areas. So in terms of violence against women, domestic abuse and sexual violence, there's been reports on surges in demand for domestic abuse helplines, concerns over online safety, stalking and harassment. And obviously this has resulted in an associated increase in adverse childhood experiences. Helpline data from Wales suggests that violence against women, domestic abuse and sexual violence has become more prevalent and in many cases more severe and complex. And it is also of note that while calls to the Welsh Government Live Fear Free helpline have returned to pre-COVID levels, this is with lower numbers of calls from agency callers, so from professional callers. So what this has shown is actually that while numbers have come back to normal, it is victims and survivors themselves that are phoning up for support and help. And concurrently, reporting to both A&E and the police has decreased in terms of domestic abuse related incidents, as victims have been less likely to report. However, what we've seen in accident and emergency data over the last 3-month rolling average is a 20% increase in domestic abuse related attendances turning up to A&E. So we're seeing quite a substantial rise currently in domestic abuse injuries turning up at health settings. So in relation to children and young people, as lockdown eases, the reporting of child sexual abuse and exploitation started to increase and return to similar levels that we observed pre-COVID. Childline, which is work as part of the NSPCC, continues to deliver a high volume of counselling sessions, mental health, and emotional wellbeing remains the highest concern for young people seeking support. And calls to the NSPCC helpline have been high during the pandemic, indicating that members of the community are reporting concerns for children and young people. And nationally, police data shows that there has been an increase in antisocial behaviour across Wales compared to 2019. Thank you, John. Next slide. So serious violence and serious organised crime. Overall, across police data, levels of serious violence and violence with injury are showing a movement again back towards pre-COVID levels, having when compared to 2019, when previously we'd seen an initial reduction. Exploitation continues to be a threat to the most vulnerable individuals and communities. However, the hidden criminality is likely to be very much exacerbated during COVID. And there has been an overall decrease in knife crime and weapon-related injuries during the COVID period. So briefly having looked at self-directed harm and violence, so looking at, which also includes looking at suicide, Papyrus, which is a helpline for individuals looking for support in this area, report an increase in calls to their helpline week on week related to the impact of social isolation. Many callers are turning to self-harm as a way to cope. People in recovery are returning to self-harm as well, and this includes relapses in substance misuse, eating disorders, harming themselves and being violent. Callers are reporting a breakdown in all kinds of former support and distraction techniques as services have been reduced, and young people are reporting that they are struggling with traumatic family environments with nowhere to escape to. Thanks, John. And alongside the violence monitoring report, the VPU sends out a short survey to gain professional insights in regards to current service demand. And this enables the VPU to ensure that changes in data-driven findings are considered within context. So this is just an example here of a number of reports we had from services. This was sort of early on in the pandemic, around April, May time. So during the middle of sort of the UK's first lockdown, and already then services such as family support services were seeing people's mental health deteriorating. The youth offending services were reporting that they'd noticed more episodes of violence whereby the child was the perpetrator and the parent was the victim. Police noticed that there appeared to be less serious violence, but an increase in minor assaults, possibly drug related as well. The revenge porn helpline found that the impact that they'd had a more significant impact to victims, having fewer resources to support them, and also more vulnerable if locked down, and victims felt more isolated if they were not with the perpetrator. And we've seen a reduction in reporting across the police, which does not necessarily equate to a reduction in the actual acts of violence. So by understanding what's going on in the sort of professional space, as well as what the data itself is telling us, we've been able to provide a much greater understanding of where services are going, of where the demand is, so that we can start to inform partners. Thanks, John. And as Lara mentioned, we've done quite a number of pieces of work around the impact of COVID, and we've looked specifically at what the impact has been on children and young people. We conducted a rapid review back in the summer, so July and August time, to capture the holistic understanding of the indirect impacts of COVID on children and young people in Wales. And this has been followed up with a health needs assessment on the impact of COVID on children and young people's experiences of violence and adverse childhood experiences. Findings due to be released within the next month. So just a couple of quick highlights from this report showed us that the NSPCC Childline, for example, had approximately 19,000 contacts per month from children. Looking at the top concerns, looking at that, were those were mental health, self-harm, suicide, poor family relationships, and emotional abuse. And the Live Fear Free helpline, which supports survivors and women and survivors of domestic abuse, found that they had a 54% increase in contacts from survivors experiencing abuse who were disclosing that they had children that were also sort of within that setting. The report Harmful Content helpline reported to us a 200% increase in reports since lockdown. And a number of mental health concerns, we found that there were reports from support services, and available data highlighted that young people are experiencing feelings of anxiety, social isolation, loneliness, and fears about the future, with younger children experiencing emotional and behavioural difficulties, with an increase in self-harm and suicidal ideation and an increase in maladaptive coping mechanisms. And overall, the report found that the pandemic has affected the population disproportionately, and children and young people have been at risk from multiple forms of adversity during the pandemic. The impact of these experiences have the potential to have a lifelong impact, and investing in intervention now could reduce the cost in the long term. Thanks, John. Next slide. So finally, I think just looking forwards, as part of the VPU's commitment to assist and support partners with multi-agency data analysis, and we are developing a violence intelligence for prevention hub. The hub will bring together data from multiple sources, including emergency department assault attendances and hospital admissions, police reported crime data, ambulance service call-out data, and walk centre data from across Wales. And in addition, the hub will also build on data that we currently receive from a wide range of partners and organisations that feed into the monthly monitoring reports, while also presenting those wider determinants of violence by considering data linked to structural inequalities and specific indicators of violence such as age, gender, ethnicity and deprivation. The hub is being developed as a bespoke data hub that will warehouse relevant data, provide a digital platform to allow for aggregation and presentation of different data sources on violence, using a range of mediums, including graphs, tables, reports, and interactive maps across local regions and the national footprint. And the hub will have the ability for users and organisations to customise how the data is presented, and it will be accessible for organisations for the purpose of informing violence intervention and prevention strategies. So thank you, John. Next slide. Thank you. So in line with our violence monitoring reports, the hub, I've just listed here the information and the violence types that the hub is going to focus on. I think at the end of the day, the VPU wants to bring multi-agency data together to provide an analysis that will show patterns, trends and hotspots of violence and identify drivers and causes of violence to enable partners to tackle these issues. So thank you for your time. I'm now going to pass over to my colleague Dan, who's going to provide a case study example of partnership working and putting evidence into practice. Thank you.
Thank you, Emma. Good morning, everyone. So I'm talking about the reopening of the nighttime economy and the impact of COVID-19 here in Wales. On the 20th of March 2020, the Welsh Government ordered the closure of pubs, clubs, restaurants and other businesses in Wales to prevent the spread of COVID-19, very similar to the other countries in the United Kingdom and across the world, following on the rise in the virus locally within Welsh areas. Pubs and clubs and all hospitality sector was closed, and we saw that for a number of weeks. However, when we got to April, we started seeing the figures drop dramatically, looking back using our monitoring information that Emma's referred to. And we saw things like an 88% decrease in the number of attendances to the emergency department, the accident and emergency in South Wales for assaults from places like pubs, clubs, bars and the street. And this remained low for a number of weeks. However, when we moved into May, and then we started to see people starting to lose a little bit of patience with the restrictions and the weather turning, we started to see an increase. And across the early May bank holiday of the 8th to the 11th of May in particular, South Wales Police and Gwent Police recorded a 38.8% and 34% increase respectively in incidents of violence against a person compared to the same period last year. And despite an initial decrease, by May, South Wales Police were reporting that levels of violence, including sexual violence, had returned to those that they saw pre-lockdown. Next slide, please, John. So we had an opportunity in Wales. John referred earlier on to Welsh Government is a devolved government, and we have responsibilities in Wales that are devolved from UK Government, and health being the main one, give the Welsh Government responsibilities for how they managed and responded to the growing levels of coronavirus in Wales with a view of putting in local regulations and restrictions in place. We were somewhat behind England in regards to a response, with Welsh Government taking a slightly more reserved approach to the way that they were tackling the virus. And this gave us the opportunity to look at England as well as other parts of the Europe and across the world to see what evidence there was in regards to response to reopening the hospitality sector, or the nighttime economy, as we call it here in the UK. So we were able to see that during the pandemic, a number of illegal parties and raves had occurred across Europe and in the UK with links to violence, organised crime, which included a potential surge as a result in COVID-19 cases. In England in particular, there were a number of illegal parties and raves which resulted in violent behaviour, particularly as the police responded to these in trying to close them down to prevent the spread of COVID-19. This resulted in a number of police officers needing hospitalisation. So looking further again across the rest of the world and looking at that evidence base, we could see that in New South Wales and Australia, there were real concerns that the hard-won violence prevention measures that they'd put in place over a number of years were being lost as a result of the drive to reopen the nighttime economy. And in Newcastle, New South Wales in particular, restrictions were placed on licensing hours to prevent violence in the nighttime economy. And this resulted in substantial and sustained reductions in violence. Next slide, please, John. So it was important, like I said, for us to have that evidence base in Wales as we look to respond to the nighttime economy reopening. And as I said, we had a number of weeks following on from others to be able to put measures in place. So we were learning from other areas, and we looked to places like in the Hague municipality in the Netherlands, who implemented a successful partnership between police, bars and restaurants, which resulted in effective management of restrictions, which helped prevent the spread of COVID-19 and to reduce violence in the nighttime economy. And a little bit closer to home, Liverpool in England allocated £445,000 towards reopening the high street safely, which enabled them to create an European-style city centre with outdoor dining and drinking to meet the social distancing requirements, and to put additional measures such as signage, street marketing, and markings on the floor, etc. in place. Additional pop-up cycle routes were planned to promote the use of bicycles as a safe way of travel. Next slide, please, John. So what we had then was a comprehensive, rapid assessment of opening up the nightlife whilst containing COVID-19 and preventing violence. This was a comprehensive report learning from other nations across the UK and across Europe and the rest of the world. But the summary report was shared with partners across those working in the hospitality sector, from policing, local authority, licensing regulations, as well as the hospitality sector themselves. And there were 9 key recommendations that were made to partners. And a number of them were related to things like partnership working, including nighttime businesses, criminal justice services, health and local authority areas. We talked about the importance of revising training, not only to prevent the spread of COVID-19, but also how they could utilize that to reduce violence, to manage crowds, to manage places where queues were gathering at the end of the night. And it was important that the messaging was consistent. And we worked with local authority and police partners, including public health in Wales, to ensure that that messaging to the public and also to the hospitality sector was consistent. But also we took care and time to think about places like pinch points, like takeaways, and to ensure that safe transport measures were in place to take people home at the end of the night, to ensure that people weren't congregating, as we had a number of restrictions in place, including earlier closures like 10 p.m. and then later on 6 p.m. And whilst doing all of this, we continue to monitor the impact of things like illegal parties and raves. So what this enabled us to do, following on, like I said, from the delays in the nighttime economy opening in Wales, was to put measures in place to not only limit the spread of COVID-19, but also ensure that all the right practices were in place to prevent violence. Next slide, please, John. What did happen then, however, we did see the opening of the nighttime economy, the hospitality sector in Wales in August. However, this was limited. Like I said, some closures initially were at 10 p.m. and this was brought forward even further to 6 p.m. as we went into winter and we saw a rise in COVID-19 figures. The nighttime economy in Wales and the hospitality sector then closed again in December, and it remains closed to this date. However, we are having conversations with Welsh Government and partners, and we are looking to see the nighttime economy reopen along with other hospitality sectors at the end of April going into May. But what is concerning for us, having looked at the data and how it rose the last time as we reopened the nighttime economy, is that we are likely to see a surge in violence. But more recently, the data is giving us concern to think that there might be a rise in sexual violence, and particularly violence towards women in regards to their safety within the nighttime economy. We are therefore, as a violence prevention unit, looking at evidence base again and drawing on previous experiences of working with the partners within the nighttime economy, as well as sectors within the hospitality sector, to develop a strong campaign using a bystander approach to drive the message home to the public that they need to look out for each other when the nighttime economy reopens, and the behaviour is important, not only to reduce violence and to improve safety within the nighttime economy, but also to ensure that COVID-19 doesn't spread further. Thank you, John.
Thanks very much, Dan, and thank you, Lara and Emma. So that pretty much draws us to the end. Just if I could just very briefly summarise, obviously COVID-19, we are really concerned around the long tail that COVID had in terms of the possible increases in unemployment, poverty and inequality. And clearly some concerns there that may also manifest in a rise in violent crime too. One of the things we haven't covered today is anything around sort of evaluation. We're very, very conscious that a lot of prevention activity is not evaluated around violence. And so wherever possible, we're seeking to, we have an evaluation framework, and we have also a number of our pieces of work independently evaluated as well. We're really keen to sort of add to that evidence base around violence prevention and be able to scale up what works. And we're really proud to be a community of trailblazers. So this work is really, really important to us, and we certainly have no complacency that we're on a journey, and the issue of violence is one that's going to need continual attention and continual application of a public health approach too. And so in the future, we're looking to continue to widen and deepen our collaboration and to co-produce more of our work as well, particularly with young people, having more of a voice in the way that we operate and more of a choice in some of the interventions that we engage in. As I say, today's been a very brief sort of tour of just a snapshot really of some of the work we've been involved in. There's around 32 different pieces of work currently ongoing within the unit, and unfortunately we've only had time to cover a few things today. I'm also really conscious that we've pretty much run out of time, and we haven't had time to get any questions. You'll see on my presentation is contact details, and again, if you look on the Hoover app, you'll see we've also got contact details on there. We'd love to hear from you is the bottom line. We're absolutely 100% sure that we don't have all the answers, and we're always looking for really innovative new approaches to violence prevention. If you've got something you'd like to share, we'd love to hear from you. And likewise, if you had a question that you wish to ask today, and we simply haven't had time to get to it, then we're really happy to pick that up after the session and get back in touch with you by email. So it's been an absolute pleasure talking to you. Diolch yn fawr, thanks very much. And I do hope to hear from some of you in the future. So thank you very much.